Okay, everybody, hey, we're live. YouTube live, Facebook live. So as people are jumping on, I'm just gonna make sure all the streams are working. And if you have questions, put them in the chat. Okay, everybody, hey, we're live. Whoops, sorry. All right. So it looks like everything's firing up and some people are jumping on. So welcome, it's Facebook Friday. And I'm here to answer your questions. So as things come up, feel free to put them in the chat there. Hey, Nikki, how's it going? Thanks for giving a thumbs up there. Let me know, folks, as you're jumping on, if you can hear me and see me, if everything seems to be working, then I know that we're on the right track here. Let's see. So far, it looks like things are working. All right. So, hey, Dee Dee, how's it going? How are things in Texas? All right, Catherine's giving me the okay sign. Thanks for that. So it seems like we're working. Everybody's probably just waiting on somebody to ask a question, myself included. So while we're waiting, oh, it's kind of like, it's like super nice and sunny here, like 30, 40 degrees. We're all, well, me, waiting for it to snow so I can go ski, but so far nothing. All right, let's see. As we're getting fired up here, so far no questions are rolling in, but I'll jump on my YouTube channel and see what questions we can find to talk about. So I had a couple of questions recently popping up about Femara and Clomid use. So I'll talk a little bit about that. I did make a video recently that I posted that talks about sort of the protocol that I use when dosing Clomid and Femara. And there were a couple questions about something really specific where a person that had a laparoscopic myomectomy was asking when, was it okay to take Femara or Clomid? And yeah, so, but it does sort of raise that question, if you've had a fibroid removed, does it have any implications beyond just getting pregnant or not in terms of how you manage the next pregnancy? And so that's a big to understand. If we open up the uterus and perform a myomectomy, we actually remove a fibroid from the muscle of the uterus. It very commonly means that you might need C-sections in the future. So it's something to be aware of before you consider the myomectomy, is in some cases it's going to mean that you have to have C-sections because you made this incision into the muscle of the uterus. That's the part of the uterus that contracts. And the concern there is that you've probably weakened that area by opening it up, and the scarring that occurs is just not as strong as your own sort of natural uterine muscle tissue. And so the problem could be that you could have a higher risk of uterus rupturing when labor occurs. So typically if you've had a myomectomy, very similar to if you've had a classical C-section where the incision is through the upper part of the uterus, that is one that typically winds up requiring C-sections in the future. All right, so let's see. Samantha's got a question here. Is it normal to have a lump under right armpit during pregnancy? Is it related? It could be. So there is breast tissue that kind of goes up in the axilla, which is the armpit. It's actually really common to see a little lump there when milk comes in. So less common to see it while you're pregnant, simply because typically there's not a lot of breast milk coming in yet. There may be some breast swelling, and so it may be just the same concept. You get some breast swelling when you're pregnant. There is breast tissue in the armpit, so maybe that's all it is. But I would say it's probably worth just getting an exam. Sometimes we'll order an ultrasound just to take a look and make sure that's all that is. Hard to say otherwise, just based on the information here. But it's at a minimum, it's worth getting checked out and perhaps considering ultrasound to investigate a little further. All right, let's see. I had a question pop up here on YouTube. Let's see. Took Clomid on cycle days 4 through 8. Got a positive ovulation test around day 13. And then it was negative by the next day, positive on day 17, negative 18. Yeah, they can be kind of confusing in terms of using ovulation predictor kits to really know. So a couple of thoughts there. One is that it's helpful if you're going to do urinary ovulation test. I recommend do them first thing in the morning when you first wake up. The urine tends to be the most concentrated because you haven't had anything to drink all night long while you've been sleeping. And so you're more likely to detect the positive on a urinary ovulation test on a first morning urine. So that may be more useful than just some other random time during the day. And the second thing is, and I actually made a video about this on the YouTube channel talking about maximizing your fertility. And one sort of key concept that is relatively new, I think, for most people is that it's really not the day of ovulation that really is your most fertile day, and other days are no good. So it's really the 4 or 5 days leading up to ovulation that are the most fertile. So if you're getting some positives in that neighborhood, then basically having intercourse every day during that time frame really maximizes your chances of getting pregnant. So that's what I recommend now. So if I had somebody on Clomid, I usually do day 3 starts. It doesn't really matter if you do day 3, day 4, day 5, but I usually do day 3. So that fertile window is kind of opening around day 10, and to have daily intercourse, between day 10 and day 13, 14, 15, and you've pretty well got that covered. And that there is evidence that shows a higher chance of pregnancy when you take that approach. So regardless of if they're, positive one day, negative the next day, and then positive again, as long as you're having intercourse during that fertile window, then I think you got your bases covered. So if you're seeing some positives, if your periods are regular, and you're covering those days, then you've probably done a good job. Okay, let's see, Jordan. What are the first steps when looking into fertility treatment for boys, but trying for over a year now? So you've been trying for over a year and you haven't gotten pregnant when you previously have conceived. So that's called secondary infertility, and that's just a term, but that's what it means. So really the evaluation is the same as someone who has never gotten pregnant. And the big things are, and there's a video on this on my YouTube channel, Jordan, so you might just take a look at that. It goes through it in a lot of detail, but bottom line is, you're trying to document whether or not there's ovulations going well. You want to check the sperm, you want to check the tubes. So those are the kind of things that you're going to look at. And so if it's been a year, it's time to start looking into that. So I'd recommend, make an appointment and let's start an evaluation. To check the tubes is pretty straightforward. That's just a hysterosalpingogram. To check the sperm is a semen analysis. Documenting ovulation you can do, through combination of basal body temperature measurements, ovulation kits, and your cycle intervals. And so you can kind of look at all those things. You can also measure a progesterone level on day 21 of a cycle, and that'll help confirm it. Those are the kind of things I do for starters. And if it's been a year, I'd recommend go ahead and give that a shot. Okay, I saw something pop up over here on YouTube. Let's see. Rachel got in August, had a miscarriage at 6 weeks. Now testing again on Sunday, 13 days past ovulation. What's the chance? The cycle was 25 days. It's hard to know from just one cycle. And I don't worry too much about if one cycle is 25 days and the next cycle is 28. Big picture, of course, is are you having regular periods for the most part. So I don't worry too much about, the actual cycle day per se, as long as it's something that's kind of regular. I'm not sure that I have a better answer for that question as it looks right there. So we'll come back to that next question here. Let's see. On Facebook, we got Aubrey. Is there a concern if your baby's measuring ahead, or is it just chunky baby? It's all relative is kind of the first answer. There's big and there's crazy big, and it really doesn't matter too much in the weeks and weeks ahead of delivery. It's more important to sort of have an estimation of how things are going in the last couple weeks before delivery. Kids can have growth spurts, and so you may see somebody at 32 weeks and they're measuring 34, and then you see them at 34 and they measure 34 again. So I don't worry too much about that. Most of the truly big babies, you'll see the big discrepancies in weight in the last few weeks leading up to delivery. So that's when I'm kind of paying attention to it. It does not indicate that baby is going to be here sooner. In our practice, we have first trimester ultrasounds pretty much everybody, unless the patient just didn't come in the first trimester. So for the most part, due dates are pretty solid. And so I don't think that it means, your due date needs to be adjusted if you had an early ultrasound. So it's more about just relatively speaking at that time, the baby was a little bigger than average, but that's really all it means. And it doesn't really predict when the baby's coming. That would be the best. If we could ever get to the test that tells us when the baby's coming, if I invent that, then I can definitely retire. So let's see. I had something pop up over here. So let's see. Okay. Any tips for successful VBAC? Yeah. So there's a whole video on my YouTube channel, which you're watching right now, so you can go look at it. And it's called VBAC. You can do it. And it talks about some just big concepts, one of which is, spontaneous onset of labor is preferred over being induced, although sometimes you got to do what you got to do. The onset of labor that occurs prior to your due date tends to be more successful than after your due date, but it doesn't mean you can't keep waiting and trying. But those are the big things. There's not a whole lot you can do, about the fact that you had a prior C-section, although the circumstances of the C-section do predict the chances of success in another trial of labor. So in that video, there's a link that you can calculate your chances of success. So I'd recommend check that out. And then watch the video. And if you have other questions, let me know. Okay. Let's see, we've got a lot of good questions rolling in. Thanks, guys. So I will get to them all. Let's see. Danielle, how common is it for twins to be conceived on a different day? Yeah, I wouldn't. So the question here is, one's measuring 13 ounces, the other's measuring 11 ounces. That wouldn't make me think that, oh, there must have been conceived on different days. I mean, the truth is that, number one, ultrasound is not a perfectly precise measurement instrument. It's taking, measurements of body parts of the baby and putting them into a formula and cranking out an estimation, and that's all it is. And so there's definitely a variation depending on how you measure the babies as to what kind of numbers you're going to get for a predicted weight at that moment in time. So it does not make me think that they were conceived on different days. The question of how common is it for them to be conceived on a different day? I mean, maybe within a day, but it wouldn't be anything more than that, I wouldn't think. So other than in pretty rare cases. So I don't think that really means anything. It's probably just an indication of the variation of measurements. Number one. Number two, if babies are non-identical, there's no reason to think they're going to measure exactly the same. They're different people, and they're going to have slightly different growth curves. So as you go through the pregnancy, the most important thing with twins is just to confirm that the babies continue to grow and basically stay on their curve. So that's all I would think about in that situation. I don't think it means they were conceived on different days. Okay, let's see. Something popped up over here. Let's see. What's your thoughts on taking Lexapro escitalopram while pregnant? Yeah, so it's an SSRI. There's a video on the channel about this that talks about the risks in some detail, and the bottom line is the risks are very low. You have to weigh that against the risk of not taking your medication. So, if you've got somebody who's seriously depressed or anxious and they're getting off their meds and those symptoms are getting worse, well, that's not good for mom or baby, obviously. So I definitely lean more towards staying on your medication than not. The only one that I'd say is, well, maybe, if you've been stable for months and months and feeling totally fine and you're thinking about getting pregnant and you wanted to wean off, you could try. But if you were unsuccessful or it became evident that you needed to continue taking the medication, I wouldn't hesitate. There's no evidence specifically for Lexapro of any increased risk of birth defects. So at least to this point, we don't have any really major concerns about that. And, in studies where Zoloft or Paxil, for example, older meds, there were a couple studies that showed slight, possible, maybe rare increased risk of certain types of cardiac defects. Again, super rare. And the overwhelming evidence would suggest there's no major concerns. And the overwhelming opinion, as many experts as I've ever read or talked to, say, don't stop taking it. So, but watch the video. It talks about that in a little bit more detail so you can get a little more info. Let's see. All right, let's see where we get to here. Christina, what's the usual route to go down when dealing with anxiety while on birth control? So, I mean, I think you got to get a history to figure out, was there any anxiety before starting birth control? Is this a completely new thing? If you had a patient who said, I never had a mood problem in my life, and I started this particular birth control, and now I'm having mood problems, well, then probably it's related. So you got to look at what you're taking, look at the dose, look at the types of hormones that are in the particular thing you're taking. There's potential for adjusting to a different dose or a different type of hormone, or even going non-hormonal with something like a copper IUD. So short answer is it really depends, and probably hard to cover every possibility during this chat. So basically, come see us and we can talk about it. All right, let's see what popped over here. 27 weeks. Should I get my membrane stripped? 37 weeks. Trying for feedback. It's fine. So the membrane sweeping thing has been studied. There's a very weak, modest, slight, maybe a little bit of a chance that it might work. There was a study that looked at people who had weekly membrane sweeps from 37 weeks to 40 weeks compared to not doing that. And the group that had the membrane sweeping had a little higher, a little better chance of not being pregnant by 40 weeks. So it seemed to have a very mild potential to improve your chances of no longer being pregnant by your due date. So I think it's safe. I think it's fine. The big things I tell people are it kind of can hurt. You might have some bleeding, and it probably won't work, but it may have a slight benefit. So I think there's no harm at all. Assuming otherwise healthy pregnancy, no complications, it's perfectly fine. Okay, let's see, Miranda. If you're 9 weeks pregnant and nausea and tiredness went away, do you worry? So yeah, I mean, freaking out, that's kind of the standard response. It by no means means you've had a miscarriage, but it also by no means means that you have not. It's really difficult to answer that question based on just pregnancy symptoms alone. So, the easy answer is just come see us, we'll catch a heartbeat, and you'll feel better. Plenty of people, the nausea just resolved and everything's totally fine. But there's no way to tell you everything's okay or not just based on that. So, if you want the thing, do just come in and get checked out. Let's see. Let's see here. Rachel, pregnancy symptoms, tested daily now, 13 days past ovulation. Why is it negative? Does it take longer? It's 13 days past ovulation. You may just not, either you're not pregnant or you're too early for the test to detect it. So I would just say, give it a few days. It's super early. And, I read a lot about that on, forums. You're like, I'm 14 days past ovulation. What do you think? There's no way to know. So the best advice I can give you is just give it a few days, see what happens. And, a few days from now, 4 or 5 days, a week, whatever, if you still haven't had a period, absolutely, check a pregnancy test. If there's still questions, then you can get a blood test in the office. But you're just so on the bubble of barely pregnant that you may just be not detecting it yet. So I wouldn't stress you out, give it a few days. Let's see, that's something else popular for Didi. 8 months postpartum, still no period. Is that normal? If you're breastfeeding, especially, it's totally normal. So nursing will suppress ovulation, and if you don't have ovulation, you won't have a period. So if you're nursing, it's a no-brainer. If you're not nursing, then it's a little weird. Depends on when you stopped nursing. So I would think about that for a second. Let me know. But if you're nursing, that's all it is, and I wouldn't worry a bit. Okay, let's see. Kira had the baby 5 weeks ago, stopped bleeding completely at 3 weeks. Is that play, or should I be concerned? Is that okay? Yeah, it's fine. Everybody's different on the exact pattern that their bleeding takes after delivery. So some people bleed every day for 6 or 8 weeks, and then, finally it stops. Other people bleed for a week or two. There's just a lot of variation. So it doesn't mean anything to me that it's anything you need to worry about. So yeah, I wouldn't worry about it at all. Let's Chris, what's the difference between chemical pregnancy and a miscarriage? Is it how many weeks you are? Yeah. So I mean, I guess just the idea of a chemical pregnancy is just one that's so early that there's no clinical evidence yet of a pregnancy in the uterus. So if you did an ultrasound, it doesn't look like you're pregnant. But if you test the hormone levels with a sensitive blood test, you can detect those pregnancy hormones. So if you miscarry in that very early window, then that's what you would call a chemical pregnancy loss. But it's the same concept. It's just a super early miscarriage. Let's see, Brandy, been having blood clots but no periods, have the IUD for 3 years, should it be removed? Not necessarily. That's kind of a short question, yes, no. I'm not sure it's that simple. But if you're having weird bleeding, let's just say, that you had not had previously, it's certainly reasonable to come in, have an ultrasound. Let's make sure the IUD is positioned correctly within the uterus, because sometimes if that IUD is a little bit out of position, you may get some weird bleeding. And so it might be a sign of that, but it doesn't necessarily mean that it should be removed. But I would just say if there's been a change in the bleeding pattern and it seems abnormal, it's worth an evaluation. And so I'd recommend that. Okay, let's see. Carla, normal period is 5 days. However, the period before Cloma was only a day and a half. Let's see, what does that say? If it happens again, should I stop the Cloma to address an issue? Not necessarily. If you've got documented ovulation through one of the means I've been talking about here, whether it's OPKs or progesterone levels or even ultrasound with a follicle check, then the bleeding pattern may just change a little bit on Clomid versus off Clomid. So in and of itself doesn't mean anything to me. The only thing I tell people is when you did a cycle of Clomid and now you have a period, and is it time to do the next round of Clomid or not? I always recommend just do a pregnancy test, because I've seen people who got pregnant, had some kind of bleeding and thought it was their period. Turns out they were actually already pregnant and just had a little bleeding, maybe from implantation or whatever. And so in and of itself, they didn't need any more Clomid. They were already pregnant. So just check a pregnancy test. That's my advice there. Let's see. All right, Lauren, seems like menstrual cramps every 15-20 minutes for an hour, and then went away. 31 weeks. Wondering if it's normal. Yeah, it just sounds like Braxton Hicks contractions. So some guy named Braxton, some other guy named Hicks, got this credit for the idea of recognizing that women have contractions but don't necessarily have to be in labor. So if your contractions are irregular, like you're saying, every 15 to 20 minutes, then it's not labor. So I'm not worried about it. And they tend to be mild. They tend to go away after a while, which is kind of how you described it. So it doesn't sound like anything to worry about. My advice is always the same. Whatever you're feeling, if it's coming and going every 5 minutes for an hour, and they're not going away, and maybe you've rested, maybe you've taken a bath, maybe you've hydrated, they're still going, then my advice is go to labor and delivery and get checked, because you might be in early labor. But if they're less frequent and they go away on their own, then I'm not worried about it at all. All right, good question. Okay, let's see. I think I'm all caught up over here. Oh, nope, there's one over here, sorry. Are AMH levels affected if you're on birth control when you take the test? Shouldn't be. But, one thing that's important to know about AMH levels, and there's a video on the channel about this as well, is they're not predictive for your chances of spontaneous pregnancy. They are predictive if you are undergoing IVF. So, but if you're talking about somebody who's just, hey, I just want to check my ovarian reserve and let's do this blood test, this recent study that showed that it's not predictive. So my advice is if this is your situation, don't even worry about what your AMH is, because it's not predictive. But in theory, birth control pills should not affect the result, because AMH is secreted by the individual follicles, and it's not hormonally mediated. They just put it out there. So it's not anything that should be affected in theory by birth control pills. But on the flip side, it's not a particularly useful test anyway, unless you do an IVF. Let's see, Jamie said, embarrassed to ask but worried, but I don't see a question that goes along with that. So maybe if you posted a question before that, just copy and paste it, because I don't see an actual question just that you're embarrassed to ask. But it's all fair game here. You're with friends. Okay, let's see. Catherine, when is it possible to schedule induction? Trying for VBAC. Husband's job doesn't leave usually a week before due date. So the short answer is it depends. You know, if you've had vaginal deliveries prior to your C-section, and so now this is your first attempt at labor after the C-section, but you've had prior vaginal deliveries, and if your cervix is favorable, so 2 centimeters dilated, then it is reasonable to do a gentle induction at 39 to 40 weeks. It still does increase the risk a little bit of uterine rupture, even in that sort of best case scenario. So we try not to do those if we have a choice. Now, sometimes you don't have a choice. Sometimes they're medically necessary because the patient's condition changes and she needs to be delivered. But in an ideal world, we'd say don't induce, especially if it's your first attempt, because it will reduce your chance of success and increase your risk of complications a little bit. So I would just keep that in mind. Okay, let's see. We got some stuff popping up over here. Let's see. Hysteroscopic myomectomy. Okay, cool. Let's see. Would you recommend a VBAC for someone with preeclampsia that will need to be induced at 37 weeks? That's kind of what I was. That's funny. I was just talking to this camera, and now I'm talking to that camera about that. So yeah, I mean, if there's a medical indication and someone needs to be delivered, then yes, like I was just saying a second ago, it may increase the risk of complications a little bit. It may increase the risk of C-section a little bit. But when you have to be delivered, you have to be delivered, and that doesn't mean you can't try for a vaginal birth. So I don't have any problem with that. You just have to know, like, it might not work. You might have to have a C-section, but it's worth a try. Hang on one second. For some reason, my stream is dying on Facebook. Weird. We'll see if it'll come back. Okay, well, while that's going, let's see. How early can they do a very early scan because of miscarriage? You know, you can see a baby at about 5 weeks, so you can see a little yolk sac, and the yolk sac will indicate that there's a pregnancy in the uterus. Now, you won't see a heartbeat until about 6 weeks from your last menstrual period. So 5 to 6 weeks is the earliest you'd want to have an ultrasound to kind of see if everything seems to be going okay. Okay, hang tight one second. I'm just going to try to get my stream working over here. For some reason, it's decided to crash. Let's see what's going on. Oh, I think I'm back. Am I back? Hang on. No, it seems like it's up. Not sure what's going on here. Let's try to refresh that. It's left it with like a... Sorry guys, I'm having technical difficulties. Bear with me. Okay, I think I'm back up. If you guys can see me and hear me, let me know. I think I had like a temporary crash there for a second, but it seems to be working again. So if you can see me, give me a thumbs up. Oh no, this is an old one. Okay, hang on. Weird. Okay, sorry. Let's see. Well, I'm just going to shut down this Facebook for a second and restart it. Stop streaming. Okay, so I think I'm back. All right, cool. So let's see. Sorry, I'm just refreshing my feed here so I can make sure that I'm actually still working. I can't tell if this is the old feed or the new feed. Here it is. Okay, so sorry guys if I lost you there. I'm back, so hopefully people will jump back on. While I'm waiting to see who jumps back on, we'll see if anybody is on here. Let's see. Okay, so let's see. Taylor, I've had a 4th miscarriage, 1 living daughter a year after 1st miscarriage. They said they're random. Do you suggest I do different to have a good pregnancy? Basically, there are some evaluations for recurrent miscarriage that I would recommend if you've had 4, and the big ones are, hey, thanks everybody who's jumped back on Facebook, by the way. Sorry for the lapse there. Just if I didn't get to your question, if you don't mind, just copy and paste it because I lost everything there. I'm not sure what happened. It was kind of strange. But so to evaluate recurrent miscarriage, that is definitely certainly something that you should consider. The big things are we'd like to make sure the uterine cavity is normal, so you can do ultrasound, hysterosalpingogram, saline ultrasound, stuff like that, to be sure the uterine cavity is normal. And then some simple things like make sure your thyroid's functioning normally. You sometimes consider doing chromosomal testing on mom or dad or both. Although if you've had 1 live-born, and I'm assuming all these miscarriages were the same partner, then that's probably not necessary because there's probably not an underlying chromosomal disorder that one of you guys have. But I do talk about that in a lot of detail in the video called Evaluation of Recurrent Miscarriage. It's on my YouTube channel, which you're watching right now, so you can find it. So check it out. Okay, let's see, Sydney, what would be a good daily fiber supplement to take during pregnancy? The typical kind of stool softener that we recommend is Colace. So it's an osmotic stool softener. It doesn't get absorbed, doesn't affect the baby in any way, and it's good for just keeping you regular. So I recommend that one. But if you truly want to stick with just fiber, then something as simple as good old Metamucil is totally fine. So you could get some of that either. And if it's gone beyond those and nothing's working, then even Miralax is okay to take. So, but Colace is a good place to start. Let's see, Carla. Mom had diabetes. Does that mean you have a higher 15 pounds overweight, eat relatively healthy? Yeah, I mean, it doesn't sound like you have tremendous increased risk. We don't totally know what the genetic component is of that. But there may be some genetic tendencies, but it's by no means a guarantee that because your mom had it, you're going to have it. So I wouldn't worry about that. It sounds like you're eating healthy. I mean, the big thing is just don't gain too much weight while you're pregnant, have regular exercise, and hope for the best. But it sounds like you're probably going to be fine. Let's see, Jenny, should still be sore from 2 weeks ago from a D&C. How would you know if you're retaining tissue? The most common symptom is actually abnormal bleeding post D&C. So like, let's say, the bleeding stopped and everything was fine, and now like a week or 2 later, now I'm having weird abnormal bleeding. That would potentially be an indication. Another quick and easy way, if it's been 2 weeks, you can probably rely on this. You, at some point, the pregnancy hormones from that pregnancy will be cleared through your urine. And so you would have a negative urine pregnancy test. So that's a quick and easy way. If you still have a positive urine pregnancy test a couple weeks after D&C, it might be a little bit higher chance of some retained tissue, but it may still be just that even though the uterus has been emptied, there's just still some residual hormones hanging around. And so you could follow blood levels to confirm that it resolved if there was any ongoing question with that. But the most common symptom is actually more like bleeding and cramping, not so much just soreness. So sounds like you're probably okay, but if you're having those other symptoms, then maybe consider getting it checked out. All right, cool. Let's see what else we got here. Let's see. Okay, let's see. Rachel, 2 previous C-sections. Could another pregnancy put stress on the scar? Yeah, we don't worry too much about 2 previous C-sections. I mean, there's a video on the channel there where I talk about, vaginal birth after 2 C-sections. So in and of itself, there's a little bit higher risk with 2 versus 1 in terms of labor. But by no means is it like, oh my gosh, this is guaranteed something bad's going to happen. The uterine rupture risk in labor from 2 prior C-sections is about 2%. So flip that around and say, what's the chance that your uterus is not going to rupture? It's like 98%. So, the risk is small. It's not something I would spend a lot of time worrying about, and I definitely wouldn't spend any energy being terrified about it because I think that, the risk is quite low. And so easy for me to say, but I wouldn't stress about that. All right, let's see. Lauren. Oh, thanks for the nice comments there. Let's see. 20-week anatomy scan, and baby's measured 97th percentile. How do they come up with that? That's a good question. We were just talking about this a little while ago before my feed crashed. So the main thing is when you're looking at a 20-week scan and you're trying to predict a due date, it can be off by 2 weeks. So because it's just not that accurate. So it's more important to go back and say, well, what were your dating criteria in the first place? So if you had a known last menstrual period and you had an ultrasound that in the first trimester that confirms your due date, then your due date is not in question. So then you look at it like, okay, well, baby's measuring a little bigger than average. But in and of itself, that doesn't mean anything at 20 weeks anyway. So it's more of a keep an eye on the growth as you go forward. Now, if you had no clue on a last menstrual period and you never had an earlier ultrasound and this is your first ultrasound, then you have to think a little bit about, well, is the due date right? And so that's the only thing, but most people nowadays have a first trimester ultrasound. So it's fairly uncommon to get into these dating questions anymore, but it can happen. So if you had late entry to prenatal care, or if you just didn't have an ultrasound the first trimester, then you do have to think a little bit about that. But beyond that, at 20 weeks, I wouldn't worry about the size. It's just not that accurate. All right, so thanks to everybody who's jumping on, by the way. Sorry for the crash earlier, but I'm glad people are getting back on. So let's answer some questions over here on Facebook. Let's see, Tiffany, is it safe to take the Chiari triangle of health supplements? I honestly don't know what that is. So hard to say, but just to talk about, supplements in general, the big picture on supplements goes like this. They're not regulated by the FDA. There's no requirement for testing to prove that the ingredients that they say are in the supplement are actually in the supplement at the levels that they claim. So there's a lot of potential for really not getting what they say that you're getting. Now, there are some, some supplement makers are more ethical than others, let's say. And you can look for evidence of third-party independent testing as one way to try to get at that, like how pure is this stuff really? Is it really what you said it was? So that's one way to go, is to take a supplement that has this kind of independent testing. But the truth is that, beyond that even, there's no data that there's any particular supplement that's good for you other than folate and iron. Those two are vital for a pregnancy to develop and reduce your risk of things like anemia and reduce your risk of spina bifida. And there's other micronutrients that are important that are in a sort of a standard prenatal vitamin. Some vitamin D is probably a good thing. But beyond that, there's really no evidence that there's any other supplements that are going to give you any particular benefit with regard to the pregnancy. So having said all that, I think most of them are probably fine. But I just don't know what's in the one that you mentioned here, this Chiari triangle, sorry. Okay, let's see. What else we got here? Oh, just talking about some testing here. So yeah, so you had one of the tests was a triploidy. Yeah, and that's random. So that's not something that's recurrent. So I wouldn't worry about that. The 69XXY. That's just one of those random things. So that should not be a repetitive problem. Let's see, Jamie. Okay, what can cause swelling, bulging, vaginal area, 24 weeks, hurts to walk, bitter pressure? Let's see. A little crampy, a little spotty. Hard to say from just the information provided here, but It's fairly common to have just vulvar swelling. You can have actual varicose veins in the vulvar area that can cause swelling. There could be a little tissue edema. So it's typically not anything to worry about. The only thing I'd say is that you had somewhat crampy and a little spotty. So, if you get to where you're having regular contractions that are coming and going every 5 minutes for an hour, or if you're bleeding like a period, then those things to me warrant a trip to the hospital to get checked out. But if it's none of those things and the baby's moving good and you otherwise feel fine, then it's probably not anything at this point that needs medical attention. Okay, Heather, when should you have your first mammogram? Short answer, it depends. It depends on family history for one thing. So let's just say if you have no family history of breast cancer, then it's certainly reasonable to start mammograms at 40. The U.S. Preventive Task Force even recommends it's okay to wait until 50. And that all comes down to the fact that there's a lot of false positives in your early 40s just due to dense breast tissue and breast cysts and things like that. So, but if it's a family history, it's a different story. And then it depends on how many family members are we talking about here, who were they. So the closer they are to you, like your mom or your sister compared to your great-grandmother, makes a difference in terms of your additional risk. So if there's like grandparents or aunts or somebody, then I'd recommend mammograms at 40. If it's first-degree relatives, mom, sister, like that, then generally you're going to say 10 years before the age of onset of that youngest person who was affected. And also, if you're talking about multiple relatives with breast cancer, you got to think a little bit about the genetics that might be underlying this. And so there are tests available that you can use. So the one everybody knows about probably is the BRCA gene, the BRCA1 and BRCA2. There are others as well now. There's the CHEK1 and CHEK2 genes. And there's probably going to be others that come down the pike. So, sometimes the best answer when that's the question is to have genetic counseling to see what it sounds like it's most likely to be and be tested for those things. But if there's none of those things, then 40 to 50 is certainly reasonable to start your mammograms. Let's see what we got over here. Let's see. Carla, job involves lifting boxes, 50 pounds. She should take extra caution. There's no evidence that heavy lifting causes miscarriage, but there's some evidence in like the industrial research of like say you work on an assembly line and all day long you move 50-pound boxes, for example. If you did that through your whole pregnancy, you may have a little higher rate of preterm birth, maybe have a little higher rate of small for gestational age babies, things like that. So we generally recommend not doing repetitive lifting over about 20-25 pounds. Now, if it's just occasionally, it's probably not a big deal. Although, you're prone to have mechanical back pain, hip pain, things like that, when you're pregnant. And, slinging around 50 pounds is a lot. That may increase the chance of just getting injured. So I think that, it might not be a bad idea to just have that restriction put in place, that there's no lifting over 25 pounds, just to play it safe. And as long as your work can accommodate that, then it's probably for the best. Let's, Amanda, how soon after a miscarriage can you try again? So this is actually a really interesting question. For the longest time, for no good reason, we told people, oh, you should wait. You should wait 3 months. You should wait 6 months. You should wait, some random period of time to allow your body to recover. And it turns out this has been studied recently, and the pregnancy rate is highest in people who tried basically as soon as the miscarriage was over. So the pregnancy rate in the group of people who started trying from sort of 0 to 2-3 months compared to 3 to 6 months, there was a definite improvement in the pregnancy rate in the group that started trying right away. So basically that's why I tell people now is start trying right away. Pretty much as soon as the bleeding stopped, then it's okay to start trying. Obviously you won't ovulate immediately, but probably about 2 weeks later you could. And so figure about 2 weeks after the bleeding stopped is kind of when that fertile window is going to reopen. And that's when I recommend start trying. There's also a video on my YouTube channel that talks about vitamin D supplementation when you have a history of miscarriage. And the gist of it was that people who had therapeutic levels of vitamin D had lower rates of miscarriage. So It's not proof yet that taking vitamin D is going to reduce your risk, but the study indicated if you had a healthy vitamin D level, you had lower risk. So makes sense to me. And vitamin D is, in normal doses is not going to hurt anybody. So I recommend to folks, especially if you've had a miscarriage, to take about 1,500 international units a day of vitamin D, just because it may help. And that's really about the only thing we have proof on right now. They've studied low-dose aspirin, turned out not effective. Looked at progesterone, not effective. So right now, vitamin D is about all there is. If you've had a miscarriage, try to reduce your risk of having another miscarriage. So I recommend it. Let's see, Tiffany, if the father's had multiples, can it increase chances of you having multiples, or is it most related to mother? It's a good question, and I don't know that that's been looked at specifically. But the concept of a family history of twins there is an association with a higher risk of twins. Now, I don't remember reading if it was maternal or paternal. So if you just said generically family history of twins, yeah, the risk is a little higher. The overall risk is still relatively small. I mean, I think in the U.S., the spontaneous twin rate is about 1 in 60 or something like that. So, it probably doesn't increase much, but maybe a little higher chance. Okay, let's see. Heather, 32 weeks, when to worry about cramping. I was just talking about this a minute ago. But bottom line is, if you're feeling contractions that are coming and going every 5 minutes for an hour, if you have stopped doing what you're doing and you kind of rest for a minute, hydrate, you could even try the warm bath trick. If none of those things are working and they're still going every 5 minutes at beyond an hour, my advice is, okay, go get checked, because if they're not going away, then better safe than sorry. If they're less frequent, if they go away, especially if you rest or hydrate, then I don't worry about them at all. So that's kind of my generic labor precautions that I tell everybody. And that's true whether you're 32 weeks or 39 weeks. Good question. All right, Chantel, are Diva cups safe to use? Yeah, as far as we know, there's no specific evidence that I'm aware of that has looked at, say comparing Diva cups to, tampons or pads or whatever else. That there's a little higher risk of very rare staph or strep infections with the old toxic shock stuff from tampons, but I've never read anything about Diva cups being linked with that. Doesn't mean it couldn't happen, but I think overall the risk is quite low for all those things, and I think the cups are fine. Okay. Let's see. Hello, Sonia from Toronto. Awesome. Welcome. How quickly does Ovidrel take to work? We had a baby dance the same night. Should we have baby dance? How many days? And I talked about this a while back, but you may have jumped on. So if you look at your chances of conception, it's really the highest in the 4 or 5 days prior to ovulation. And so my advice is daily intercourse during those 4 or 5 days. So if you had intercourse the day of the injection, if you had intercourse the day before, and then the day after and a day or so beyond that, then that's about 4 days. You've pretty well got your window covered. So this concept of like, here's the one day and we're going to try to drill down on this one day and this is the day is really kind of outdated. And this concept of a fertile window is really more accurate. And this is evidence-based. So there have been studies that looked at conception rates when you had people who were having daily intercourse during this time versus every other day versus just like the day. And you could just see the pregnancy rates go down, down, down. So daily intercourse in the 4 or 5 days leading up to ovulation is pretty clear now to be the best way to go. So you sound like you're starting to get your bases covered. So keep going and good luck. Let's see, Taylor, I did that with this miscarriage. Got pregnant right after the third, really thought it would be a good one, now being told to wait a while. Yeah, like I said, there's no evidence that that waiting is of any value. So assuming everything is otherwise okay, then I don't see any reason why you need to wait. All right, cool. So I think I got caught up. I'm sure there were questions that I missed over here on Facebook. So sorry, you guys. I had this, I don't know what happened. It crashed. So there may be questions that I didn't get to because it died and maybe people left and didn't even jump back on. So, but if I didn't answer your question, please just repost it because I probably just missed it. All right, take a breath here. Let's see. Any specific vitamin D? No, I'm not, like, I don't think there's any evidence that one's any better than another. So, but the dose to get you to a therapeutic level, about 1,500 international units a day will get you there over the span of about a month or so. Okay, let's see. Is cramping normal after ovulation? Yeah, it's really common, and in and of itself, not anything that is any concern. Let's see. Courtney, what would brown spotting mean when your period ended over a week ago? Probably not much. With just that little bit of information, it's hard to say much beyond that. Big picture is more like, what are your periods in general? If every month you have a regular period and every month a few days later you have a little spotting, it probably means nothing. If you have bleeding in between your periods that's heavy and weird and all that, then it could indicate something's going on, whether it's some sort of hormonal fluctuation or something like an endometrial polyp. So I guess the big picture is, if it was one episode, I wouldn't worry about it. But if it's recurring, then it's not wrong to just come in and get an ultrasound and make sure that structurally the uterus looks normal. It's really helpful in those situations to keep a menstrual calendar so we can kind of look at it and try to get the big picture of what's going on. So those are the kind of things I'd recommend. But if it was one episode and nothing else, then I would just ignore it and see what happens going forward. Let's see, Amber, does B12 really help wake you up more? No, not really. So there's a huge placebo effect when you start talking about vitamin supplementations and subjective symptoms like fatigue or energy. So yeah, there's really no evidence in of itself that that's going to do anything for you. Unless you're vitamin B12 deficient, and then in which case it might. Let's see. Let's see here. Had a C-section. Doctor removed 2 fibroids. They were out of the muscle. Yeah, in and of itself, that shouldn't increase your risk if they were really superficial. The sort of general rule of thumb is, if you had to incise 50% or more of the depth of the myometrium, the thickness, then you should have a C-section in the future. If it was less than that, and like you're describing is really superficial, then it's no concern at all. So it probably doesn't play a role at all in predicting your chances of success for a VBAC. But if you look at on this YouTube channel, there's a video about that, and there's a link in there you can go into and you can calculate your chances of success. And so that's the best advice I can give you, is take a look at that. If you get 60% or more as the predicted chance of success, then absolutely my advice is go for it. So check it out. Let me know if you see it. Put a comment on the thing and I'll watch for you. Let me know if it helped you. Okay, let's see. Carla, doctor told me prior to prescribing Clomid, you may have mild endo, and told you to take Clomid anyway. Is that accurate? I mean, you might have mild endometriosis. I couldn't tell you yes or no at this moment. There's no evidence that Clomid's going to hurt anything, so I think that's fine. Does pregnancy fix endometriosis? Probably not, but the predominant hormone of pregnancy is progesterone. So you make a lot of progesterone when you're pregnant, and we often treat endometriosis symptoms with progesterone. So maybe from a symptom standpoint, whatever pain you might have from endometriosis may be calmed down by the hormones of pregnancy, although you're going to get a lot of other pains from being pregnant, so it's kind of a tough trade-off. But there's no evidence I'm aware of that has looked at long-term outcomes of endometriosis patients who then got pregnant to see if the ultimate course of their endometriosis got better or worse. So I think it's certainly reasonable to try. It's not going to hurt anything, and so I don't see any downside to that advice at all. All right, let's see. Sydney, do you think there should be a waiting period between full-term pregnancies? Yeah, so this is interesting. So there's some research on this question, and there is a little bit of risk to this concept of the short inter-pregnancy interval. So, and short is a vague term, right? So if you just said, well, look at like less than 2 years between deliveries or less than 18 months, and studies use different endpoints, but But at 2 years between deliveries is certainly not short, but less than that you could start to argue is short. And so if you use that as just kind of a benchmark and you look at outcomes, you'll find some interesting things. So one of the things that you will see is a higher chance for preterm birth and small for gestational age babies, so smaller than normal babies. And even I think there was an association with actual growth restriction, which is not just small, that's like pathologically small. Now, it doesn't mean that everybody who had a short interval had these problems, but if you looked at their rate of these problems and compared it to folks who had a longer interval, there was a higher risk. So, and it wasn't a humongous risk. I don't remember the exact number, but let's just say it was 15 or 20% higher as some kind of ballpark number to use. So you can just kind of think about that. Now, on the flip side, there are people who are getting older. Let's say you're 37 and you want to have another baby and you don't really want to wait 2 years because then you're going to be 39 and I wouldn't blame you at all. So I think you have to balance those type of concerns when you counsel somebody about that. If you're 25 and you're like, hey, I want another baby, when can I do? Well, a year and a half, 2 years is certainly reasonable advice. Doesn't mean you have to stick to that. But that kind of gives you a feel for it. Now, the questions of why do we think this happens? One concept is this concept of unresolved inflammation. So when you're pregnant, there's all these weird immune system things that happen that sort of prevent you from rejecting baby because they're half immunologically not you. So why doesn't your immune system just go on the attack? So there's some changes that occur in your immune system. There's also changes that occur just locally within the uterus and cervix and vagina that are pregnancy related and can be sort of inflammatory. And if you don't let that resolve, does that somehow play a role? That's a theory. So long-winded way of saying it depends. It's not a huge deal, but those are the kind of things that I would think about when someone asks me these questions. So hopefully that helps. All right, let's see what we got here. Do you think ovulation tests are accurate? Been using them for months and got pregnant once, only to miscarry. I think they can be useful. They are sometimes helpful to try to figure out, is someone ovulating or not, but you can often figure that out just from their menstrual history and things like if you have premenstrual symptoms or not. But in terms of like timing intercourse to maximize fertility, they can be somewhat helpful. I've kind of been saying this over and over, but this whole idea of the sort of 4 or 5 days leading up to ovulation really are the most fertile window. So, whether you just have those days covered or try to track it with an OPK, ultimately probably doesn't make a big difference. Interestingly, the most accurate predictor of ovulation is not an ovulation predictor kit. It's kind of ironic. Cervical mucus is the most consistent indicator. So, and I talk about that in that video. It's called Maximizing Your Natural Fertility or something like that. It's in the Infertility Trying to Conceive playlist on this YouTube channel. So check that out. It talks about it in detail. All right, Sydney, do you think being induced could make labor harder or take longer? Don't think it makes it any harder, but it definitely makes it longer if it's your first baby. So if it's not your first baby, I don't think it matters at all. But interesting about this whole concept of inducing a first-time mom, there's a huge new study that came out. There's a video on my YouTube channel about it, talks about it in detail, that is called the ARRIVE trial. And we actually participated in this trial through McCady. We had a ton of patients who were in the trial. And they took first-time moms, and they either were induced at 39 to 40 weeks or wait until 41 weeks. And that was kind of the protocol, and unless there was a medical complication that required them to be delivered. So the endpoint that was most interesting was the C-section risk. So, forever we have thought that induction of labor increases your risk of C-section, and fascinatingly, I think, the study showed a reduction in the risk of C-section, somewhere on the order of like 18 or 20% lower risk of C-section in the induction group. And so the concept of not being induced to reduce your C-section risk turns out is completely the opposite. So yeah, Sydney, you were part of the trial. So the one additional finding that they found was that labors were longer. And I think that's kind of not a big surprise. You know, if you're being induced for your first baby, then it's going to take longer. But that's okay. I mean, I think the main thing to recognize is that's normal. And so you have to be really careful about doing or thinking about doing a C-section because it's taking too long, for example. So that was a big part of that trial was, you know, having pretty strict criteria for calling something a failed induction or a failure to progress or whatever. And you know, in that trial, I want to say the C-section rate in the induction group was like 11%, which is crazy low. The national average zone was 30. So it's a huge reduction compared to the national average. So, but you just have to know that they will take longer. Now, if it's your second baby, I don't think it makes a difference. So spontaneous versus induced labor, it may make a difference by an hour or two, if that. But for first babies, you know, for sure it did. And maybe you remember how long was your labor, because I can't remember. So yeah, good question though. Let's see. Is there something to help the uterus heal faster or better after hysteroscopic myomectomy? Not that I'm aware of. But it's good that it's hysteroscopic, so that tells me you don't have to worry about having a C-section because that was just within the cavity of the uterus. We don't really have super great strict criteria to know how long should you wait before you try. Probably 2 or 3 months is arbitrarily seems reasonable. But there's nothing I'm aware of that has been proven to be effective at helping things to heal better or quicker. So don't have a good answer for your specific question. Sorry. Let's see, Julia. How dilated do you have to be considered in labor? Well, the actual answer for the definition of labor is not just what is your cervix. So the definition of labor is painful regular contractions that lead to cervical dilation. So changing your cervix is the key. Not that you just walk in and you're 3 centimeters or you walk in and you're 5 centimeters. You can be 3, 4, 5 centimeters and not be in labor. But if you have somebody who, let's say, was 3 centimeters, is having regular contractions, and cervix changed to 4 or 5 centimeters, that's labor. So it's the change in cervical dilation, not so much just the number. And the fact that you're having regular contractions during that time. Let's see. Got induced at 40 and 5, went at midnight, had dark 10:30. Yeah, you did better than average for sure. All right, let's see. And Amber, same thing. You guys are seed demons. That's great. It's not everybody gets so lucky, but I'm glad you guys both did. Let's see. Okay, got some questions rolling in here. Let's see. Have been doing acupuncture for 3 months to help with hormones and trying to conceive. Do you think that helps? Actually, that's been studied, and the answer is it doesn't. And I was gonna make a video about that, and just never did. But there's a study in Australia that looked at several hundred women. I can't remember the exact number. And it was a really well-designed study, randomized, placebo-controlled. So they had certified, experienced acupuncturists, and they did sort of whatever the standard acupuncture technique is supposed to be to help with fertility. And then they had sham acupunctures where they put the needles in like the wrong spot on purpose. So of course the acupuncturist knew, but the patient did not, and the doctors did not. So they didn't know if it was the sham or the real deal. And this was in IVF. So this is not necessarily spontaneous pregnancy, but in an IVF setting. And there was no difference in the conception rate. There was no difference in miscarriage rate. There was just no difference at all. So I don't think there's anything wrong with doing it, but I just think it's important to understand there's no proof that it helps. I don't think there's any harm. It does cost money. So if you want to look at it from that perspective, and you know, you could argue you're spending money on something that's not proven to be effective, but I don't think it's harmful. Let's see. Was that a 6, 37? Yeah, that definitely, you were a good cervix there, Amber, for sure. Okay, cool. Let's see. Let's see. Carla, I don't get the cervical mucus, but had a positive LH at 50 milligrams. Clement, cool. All right, let's see. Previous question about C-section and 2 fibroid removal. Plan to get pregnant after 8 months. Very much want to have a C-section. Yeah, like I said before, I don't see that as a problem. I wish you the best of luck. I check out the video, you know, on the channel there, and there's a link at the bottom in the description that that you can plug in your own numbers and see what your chance of success is. Hopefully what you're getting is something like 60% or better. If you're getting 60% or better on the predicted chance of success, then I would encourage anyone to try, especially assuming you've had 1 or 2 prior C-sections, but not more than that, and assuming they were low transverse, not a classical C-section. All right, cool. Let's see. Did not have periods for the last 2 months, then had it for 2 days. Hemoglobin drops, stopped taking iron. Hemoglobin levels never dropped before. Also take SRIs, but really low doses that do that. I don't think so. So yeah, I don't think your periods or your anemia have anything to do with taking an SSRI. Without much other information, it's hard to say if there's anything else to expand on that question, but hope that helped. All right, cool. Let's see. So there's definitely still some people on Facebook. I'm not seeing any questions. So if you guys have questions, feel free to stick them in the chat there. Oh no, battery died. Bummer. Hang on. My battery just died on the Facebook. Let me just tell them sorry. Sorry guys. Battery died. On the camera. Go to my YouTube channel if you want to see more live. I'm on there also. Just search Wes D. Ski on YouTube. Okay. Oh, cancel. All right. So the live video just died on you can still hear me. That's crazy. Oh, that makes sense because the microphone is not part of the camera. I have a separate powered microphone. So that's crazy. Okay, well now it's just like a podcast for you guys. So feel free. I can see your questions still. So I won't end the feed, but you're welcome to jump on YouTube. I'm over here also. I was just kind of doing like a 2-for-1 today. So feel free to jump on my YouTube channel if you want, or if you want to just listen, that's great too. Either way, but I'll keep the feed up. Thanks for reminding me, Sydney, that I still have audio. So if you have questions on Facebook, feel free to put them in the chat or jump over on YouTube and you can see my lovely face if you want to. All right, cool. Let's see. Carla, can you take Vitex along with Clomid? Is it best not to take any herbal supplements? Vitex is fine. And some of the fertility docs do recommend that supplement. And I don't know a whole heck of a lot about it, but I think it's fine. Let's see. Next question. How can we treat anemia naturally? I want to get pregnant, but hemoglobin levels always low. Well, anything that is iron rich. So any food, so spinach, go like a Popeye, eat your spinach. So any kind of green leafy vegetables, particularly spinach, is rich in iron. If you're not a vegetarian, then obviously red meat is a good place to get iron as well. So that's about it, other than just taking iron. Do you think stress causes miscarriages? No. I don't. There's no evidence that I'm aware of in any study ever that found a link between stress and miscarriage. So I don't think stress is like necessarily a good thing, but I don't think it causes miscarriage. All right, so I'm just laughing because my Facebook channel, sorry guys, if you're tuned in, there's still people watching, it's in the dark. Sorry about that, the camera battery died. But the pictures are still going on YouTube and the audio is still going on Facebook, so either way, whatever works. Let's see. What's your opinion about prescribing progesterone tablets to avoid miscarriage? Yeah, I was talking about that a little while ago. There's no proof that progesterone supplementation reduces your risk of miscarriage. It's been studied, and there's just no proof. So I don't think it's harmful. I've had patients who came in saying, look, I'm taking this. Is it okay? Yeah, it's fine. But I think it's just important to know it doesn't reduce the risk. You're right. Like 2/3 of all miscarriages are chromosomally related. So it's not going to fix that. So good question. All right, let's see. Sydney, when do you decide to cut during labor? I guess you're saying like, what would be the reason? What's your time frame or indication for doing a C-section? I'm assuming that's what you mean. Totally forgot the word. I'm assuming you mean C-section. So, the the logic for when you do a C-section, sort of the criteria has, there are very clear guidelines nowadays, and you can kind of put them into two categories. You know, one of which is fetal intolerance to labor. So if you have fetal heart rate tracing that is concerning and delivery does not appear to be imminent. Oh, you're talking about episiotomy. Okay, I'll come back to that. But since I started this thing on C-section, maybe somebody wants to hear it. So, you know, fetal distress is still a valid and certainly very reasonable reason to do a C-section. The other is sort of prolonged labor. You really have to be in active labor at least 4 to 6 hours without cervical change before I would recommend a C-section. That's based on well-established evidence-based guidelines. But what you were asking was about episiotomy, so sorry. So, you know, honestly, I think I might get through this whole year without doing a single episiotomy. I don't remember the last time I did one. So it may not have been a year yet, but it's getting close if it's not. So there's actually very few true indications for an episiotomy. And there is definitely evidence that doing an episiotomy increases the rate of birth trauma to the mom. So if you look at the risk of 3rd and 4th degree lacerations, you will find that they are higher in moms who had episiotomies. You'll also find that they're higher in operative vaginal deliveries. But sometimes you just got to do that because maybe it's stuck or it's an emergency or whatever. I'm just adjusting my camera here since the other camera's dead. Circle of Life's on here. What happened? The camera died. So the camera battery died. So the audio is on a separate power channel. So it's not dead. So yeah, that's what happened. So it's still going on YouTube because that's my phone and it's plugged in. The camera battery died, but the audio still works. So I told people they could jump on YouTube if they want to see my smiling face, but otherwise, just keep listening, I guess. Christy asked a question about surgeons at McKay for a double mastectomy. So generally speaking, all of the general surgeons in this area, for the most part, I think, do breast surgery. Now, maybe not every single one. Hey, thanks for the nice words there. You know, without like naming individual names, pretty much there's multiple surgeons in town that do breast surgery. I don't know that anybody specifically is like a breast cancer specialist per se in this area. I think they all do them, or the vast majority of them do them. So, you know, there's docs at McKay specifically who work there. There's docs who are out in the community who work at McKay. So there's plenty. So if you need a referral, you can let us know at the office and we can certainly help you out there. Let's see. Rachel, if you have a VBAC, hang on, and have burning, pulling pain and end up ruptured, is it fatal? What's the chance of happening? You know, interestingly, the number one symptom of uterine scar rupture is not pain. The number one symptom is an abnormal fetal heart rate tracing in labor. Most uterine ruptures that happen happen in labor. It can happen before labor, but they're rare. So, you know, for the patient who's coming in saying they have scar pain and things like that, it almost never is associated with uterine rupture. It's much more likely to be abdominal wall related, some stretching of the skin incision, but not the uterine incision. So it's something that should be evaluated because you never know, but for the most part, it's not one that is predictive of uterine rupture. Okay, so hey, if you're just jumping on the Facebook feed, sorry, there's no picture. The camera died. There is a picture on YouTube channel if you want to watch that. But apparently the audio is still working over there. Let me know if you're listening. Hit a little thumbs up or something. Let me know you're still out there listening. But if you want to see pictures, jump on my YouTube channel. I'm also live on there. Okay, let's see. Back from Italy. That's right. Your question is coming soon. I'm ready. Just hit me whenever you're ready because I've run out of things to talk about. And I forget what part of Italy you're in, but it's amazing that I'm talking to you through the internet, through my camera, live to Italy. It's nuts. I just saw one little thumbs up go by on Facebook. That's funny. All right, so we're gonna give us a couple more minutes. If anybody else has a question, sorry for the no visual on the Facebook feed. That's a first for me. Might as well stop recording over here. So we'll see if any other questions pop up here in the next little minute or two. Turin, that's right, Turin, yeah. Okay, well, let me know what your question is. You said it's coming soon. I'm waiting with bated breath. You've come all the way from Italy, so I need to wait for this question. I must answer it. But yeah, there's still okay. People are dwindling off now on Facebook. Oh, 6, 7. Hey, there's still people here. 6. Oh, somebody jumped on and went. There's no picture. I'm out of here. There's still people listening. That's hi, you guys. Tell me if you're here. Who's still listening? It's amazing. It's pretty awesome. I've run out of things to talk about though, so hopefully I'm waiting for a question from Italy here on YouTube. Here we go, Carla. Skipped question. Let me see. Thanks for letting me know. Let me see if I can roll back and find it. We talked about progesterone, so I don't think I skipped that one. And we talked about the fibroids. I think I got them all, Carla, but thanks for pointing it out. You may have just missed it, but I did. Yeah, it answered. I answered. Good job. Thanks. Thanks, guys. So let's see. And you're welcome. Hey, for you guys on YouTube, where are you watching from? I know Italy. That's probably going to win for the furthest distance from Ogden, Utah today. But if you're still out there watching, let me know where you're watching from. Or if you're just listening on Facebook, let me know where you're listening from. Let's see, I got a comment. Somebody on Facebook. Let's see. How many water should you drink during pregnancy? So like, how much water should you drink? And then Christy was saying, should you schedule a PAP and a checkup before surgery? Certainly come in for a checkup, get things checked out. We'll figure out what's going on as far as getting you scheduled. You may or may not need a pap smear specifically because the pap smear guidelines have changed. And I should probably make a video about that. And as a matter of fact, because I'm always thinking of what am I going to make the next video about. I think it might be that. Stay tuned for a longer answer. But the short answer is you might not need one. They're not every year anymore. It could be as infrequent as every 3 or 5 years, depending on the situation. So stay tuned for that. Let's see. But anyway, Blanca was asking how much water should you drink during pregnancy. The short answer is a lot. Probably minimum of 100 ounces a day, and more is better within reason. The easy way to know for sure if you're staying well hydrated is to just look at the consistency of your urine, the color of your urine. So if your urine is coming out just crystal clear, looks like water, then you're adequately hydrated. Your kidneys are really one of the smartest organs in your body. So if you are just having tons of clear urine, then you're well hydrated. And if it's dark and there's not much of it and it's kind of stinky, you need to drink more. And so that's an easy way to go, is just look at the urine. But probably 100 ounces a day is a good, just throw the number out there to let it stick for now. All right. Let's see, the question from Italy. Here it comes. Still trying to conceive. Started to give maca a try. I'm not sure what that is. Have you heard of? I've not heard about maca. I don't know what it is. Are older moms more likely to have twins? Let me know if you can type out what that is, because I don't know what it is. Are older moms more likely to have twins? Yes. So age is a risk factor for twins. It's not a huge risk, but definitely as you get late 30s, early 40s, the risk of twins is going up for sure. Let's see, Amber, if your mom got breast cancer at 45, when did you get tested? So 10 years before the age of onset is the answer. And the follow-up question is, have you been tested yet for the BRCA gene mutations? Because there's definitely a risk of that. So just, if you haven't had that discussion, that's a discussion worth having, is should you have a genetic assessment for your risk of breast cancer. The BRCA1 and 2 genes are the two most common. There are a couple others now, but at any rate, at least having that discussion is worth your time, I'd say. Penny says, I hardly drink anything and urine has no odor. What does that mean? It's a good question. I don't know. You have super kidneys. I don't know. Okay, speaking of drinking water, you guys just got the sound effect on Facebook. You didn't even get the visual. Let's see. Oh, you did it, and it was negative. Good. So the only sort of kicker to that is, so I would definitely start mammograms at 35, so 10 years before the age of onset of your own. There will probably be other breast cancer genes that come out in the future. So someone was telling me that at the lab they had their BRCA gene mutation out, that they were told that they will they save their samples and they will rerun them on any new genes that they discover and can test for as they go, which is amazing. I never heard that before. So if that's true, that's great. That gives you a little peace of mind that, because when they discover BRCA3 next year, well, you want to be sure you got for that too. So it sounds like at least some of the labs are doing that, but that's a good question. If you know which lab you got tested through, you could, call them and find out. Okay, let's see. So the maca thing is a plant-based supplement in a powder form, comes from Peru. Yeah, so short answer is we're not going to know because it has not been tested in pregnancy. There's no evidence for any particular supplement with the exception of vitamin D when it comes to your risk of miscarriage. So if you are low on vitamin D, you have a higher risk of miscarriage. If your vitamin D levels are adequate, you have a lower risk of miscarriage, and you may even have a higher rate, of pregnancy. There's a study that I quoted, and there's a video on the YouTube channel talking about that. So if you haven't seen it yet, look in there. It's under the pregnancy/trying to conceive playlist, and it talks about it in some detail. But the supplement that you're asking about, there's going to be zero proof of any benefit just because it's not going to have been tested in pregnancy. Can guarantee you that. All right, good question. All right, cool. There are still 4 people on Facebook. It's amazing that have 3 people. We're down to 3. Okay, well, we're back up to 4. If you just jumped on and you're wondering why you only hear me but don't see me, it's because the battery died on my camera. But there is audio still, and if you want to see pictures, you can jump on YouTube. I'm over here too. Let's see. My pleasure. Let's see, Carla, is vitamin D in prenatals enough? I would, there's not actually. I've looked at most prenatals have like little to none of the vitamin D. I would get about 1,500 international units a day of really any over-the-counter vitamin D supplement should be fine. And I would take that in addition to your prenatal. So, because there's really not very much vitamin D in most prenatals. We're down to 2 on Facebook. 2 people, bless you, are just listening to my voice but not seeing any images. That's cool. It's crazy. Love it. Okay. Well, we're up to 3. Now we're back down to 2. This is awesome. Okay, we'll give it another minute or so. If there's any last minute questions, let me answer them for you real quick. Otherwise, I'm gonna jump off here because my camera's dead. I've run out of things to talk about. That's pretty good. I've never talked so long that the battery died on the camera. So that's pretty good. We've been streaming for like over an hour. I guess the battery lasts about an hour. Okay, so we'll give another minute or 2, and if anything else pops up, I'm not seeing anything on YouTube. I'm not seeing anything on Facebook. Let's see, came back negative. Oh, you did the saliva test, yeah. So that's a BRCA1 and 2 gene test, Amber. It is, so it's very reassuring that you were tested for this. There are others, so it might be worth calling the lab that ran your test, and I don't know which one it was, but if you don't know, you can check with the office. They can probably tell you. For this concept of there are new genes that come out, every couple of years there's a new discovery that says, oh, look, there's BRCA3, or there's a gene called CHEK. So there's CHEK1 and CHEK2. Are they running those also, or was it only the 2 that you tested for and that's it? So it's worth asking. It's worth following up on. Blanca, here's a question. I had one more question. Can you use a muscle rub cream while pregnant, like a muscle leg or thighs? Probably fine. The only ones that I would tell you to use caution with are like anything with aspirin. So like Aspercreme is an example. That's over the counter here in the U.S. And it has aspirin in it, and you probably do absorb some of that into your bloodstream, and that is, if the levels were high enough, could potentially be a problem for me. So, low dose aspirin can actually reduce your risk of preeclampsia. Higher dose aspirin can cause problems for people's hearts. So there's a fine balance there. So as long as it's not aspirin based for your cream, you're fine. Let's see, lots of vitamin D from the sun. That's true. If you spend a lot of time in the sun, you will be therapeutic, but it takes a lot of time in the sun. Then you probably have a higher risk of skin cancer. Let's see. Husband found a cyst on his testicle when he was 17 and didn't know it would affect fertility. Should he go back and check? It never hurts. I mean, has he had a semen analysis? That's the question. If he's had a semen analysis and it was normal, then I wouldn't worry about it. But if you have somebody who's trying to conceive and they're not having any luck, and you have, just in general, if the guy has not been checked out, then they should be. And particularly if there's some question of some sort of abnormal finding from years ago that was never followed up on, probably a good idea. Let's see, currently taking 50,000 for deficiency. Yeah, we don't, it's a good question. We don't know what those kind of mega doses do when you're pregnant. I would back down to the 1,500 a day when you're pregnant, only because we just don't have data on high doses like that. I don't think there's any harm with trying to get pregnant, but if you get pregnant, I'd back down to kind of more of a normal dose. There's still one person hanging on Facebook Live, you guys. This is awesome. Oh, we're up to 2. Oh, we're down to 1. There's still one person hanging on, and we're up to 3. This is crazy. If you're just jumping on Facebook and you're wondering what the heck is going on, I can hear this guy, but I can't see him. It's because the battery died on my camera. I've been streaming for too long. If you have a question, you can stick it in the comments. Otherwise, I'm going to wrap this up here in another minute or 2. I'm just amazed. Bless you, man. Hanging on. There's still one person hanging on. It's pretty crazy with no video and audio. To the one person on Facebook, if you're wondering what that sound was, that was me drinking water. This could be like an ASMR session. If you don't know what ASMR is, Google that. Okay, seeing any other questions popping up, so I think probably about time to wrap this up. Thanks to everybody who's watched and or listened to this live stream on YouTube and Facebook today. Oh, we got one more jumping out here. Taylor, where am I? I'm in Ogden, Utah. Come on out. This is probably, you can get a direct flight to Salt Lake City. We're about 30 minutes north. Thanks for the nice comments though. Good luck. Carla, here we go. We'll let Carla's question be the last one. Carla says, Clomid cycle unmonitored. Are there indications that should probably ask to be more closely monitored? Yeah, if you're not getting pregnant, that'd be the big one. Personally, my protocol, and there's a video on my YouTube channel, maybe you've already seen it. I like lay it out day by day. Here's exactly what I do. So maybe look at that. That'll give you a good idea of like one guy's approach to how he does infertility stuff with Clomid. It's also true for Femera. And that'll give you an idea of kind of how I do it. Not that my way is the only right way. But I think, if you've been through a few cycles and you're not getting pregnant, then get it checked out. You're welcome, and good luck. All right, well, I think we'll call it right there. Thanks to everybody for watching and or listening. It's kind of crazy. Hope you guys have a great weekend. Thanks as always for your questions. I really do appreciate and enjoy doing this. So thanks for putting your questions in. Thanks for sticking with it through the technical glitches today. Hope everybody has a good weekend. Happy Thanksgiving next week. I'm on call, so if you're having a baby next Thanksgiving, I'll see you there. One last question here. Period used to last 6 days, but after 30 it went down to 3. Can that affect fertility? Well, the period doesn't affect fertility, but age can. So if you look at kind of conception rates before pregnancy, before 30 versus after 30, there is a little drop. So that could be part of the question. Or it could be part of the problem. All right, that's it. We're going to wrap it up. Thanks to everybody. Have a great weekend. I'll see you on Thanksgiving if you're having a baby at McKay or Ogden Original for Circle of Life on the Go On Call. Have a good weekend. Thanks. Bye.